Discussion on chat STOP for initial management of cardiac amyloidosis. Targeted therapeutic measures depend on the type of amyloidosis, whether it is light chain or transthyretin type. Chat STOP is the mnemonic for the initial steps in the management of cardiac amyloidosis. C. Conduction and rhythm disorder prevention. H. High heart rate maintenance. A. Anticoagulation. D. Diuretics. Please subscribe to this channel for future updates. Click on the subscribe button. Press the bell icon after that for all updates. Stop beta receptor and calcium channel blockers, digoxin and renin-angiotensin-aldosterone inhibitors. Preload reserve is limited in cardiac amyloidosis due to severe diastolic dysfunction. Hence, the only way to increase the cardiac output is by the heart rate reserve, and hence it should not be cut down by beta blockade or calcium channel blockade. Renin-angiotensin-aldosterone inhibitors carry the risk of severe hypotension, especially in the presence of autonomic nervous system involvement. Cautious use of diuretics is useful to reduce the congestion of heart failure, but excessive diuretic usage can lead to low cardiac output. Amiodarone can be used as an antiarrhythmic agent if needed. Anticoagulation may be needed in case of supraventricular arrhythmia like atrial fibrillation, previous history of systemic embolism, or intracardiac thrombi. There is a higher chance of thromboembolism in cardiac amyloidosis even in sinus rhythm. Pacemaker implantation may be needed in some cases of cardiac amyloidosis. Here is an important journal reference. Please don't forget to subscribe to this channel for future updates and click on the bell icon for all updates. Thank you.